And our step one for automation purposes is appointment scheduling and patient registration. So this is where someone calls and someone ends up booking someone for 3 different times under 2 different names.
Oh, that's
why we need automation.
Oh yeah. Right. So the way it works, we're gonna show you for each of these 8 steps. We're gonna show you some case studies that we actually did at Karl, as Karl mentioned before. So let's jump in. If you have any questions, feel free to ask them on chat. I'm gonna be monitoring chat and responding to your question. Hopefully, if I don't miss anything.
Yeah, it's a good point. Anytime you have a question, anytime really, feel free to write it down. We'll be taking, breaks between each one of these steps to see if anything will be asked for, and if we did miss anything, we'll come back to it at the end of the webinar.
Great. Okay, so I'm going to start. We have, I think, 3 case studies for this step one. Step one, appointment scheduling and patient registration. So we start with the case study. I need to make it a little bit zoomed out. Perfect. Appointment scheduling. So for one of our clients that was actually creating their own online scheduling platform and EHR, they wanted to migrate, get more market share and migrate more information, more patient, more clinics into their software. Karl.
Yeah, just for context, this is kind of like ZocDoc in the United States, but it's international. It's international everywhere except the United States. So basically in Europe and South America.
Right. So they wanted to get practices of their current EHRs, so they migrate into their online scheduling platform. The problem is those practices were a little bit used to their current software and were a little bit reluctant to the change. So
this is a common problem. This is a common problem in automation, and sometimes a hurdle to get over is that some people get comfortable doing things the way they do the things, right? Because we'll go to companies and I don't know, let's say management wants to change something, but the actual worker is like, but why? We've been doing this for 15 years like this and it works. Why? And why change? Why fix it?
So with that one, they actually came to the conclusion that we should sync the visits, the appointments in between their booking platform with the currently existing.
Just for transition period.
Just for the transition period. And thanks for mentioning the transition period, because I wanted to mention that actually boosted their sales by over 8% within just a few months. So basically they managed to convince other practices to do the switch, to do the transition period, just because everything would be synced out in between the new scheduling platform and the old one.
Yeah, so we basically made a connector and we made it easy for them to transition, because migration is a pain.
Exactly. So we did that for 9 different EHRs and got it deployed in 5 different global markets. And Karl, we have a question on the chat. Does it work with any EHR? Or just some specific ones?
Yeah, basically what we do is we automate processes, and we can integrate any program. It doesn't even have to be an EHR. It could be your accounting software that you use alongside with your EHR, EMR, your Gmail, your Outlook, your billing software, your communication devices, basically. So we can find a way to integrate and automate one of the portions or all of the portions and make them work together to streamline and automate.
That's true. And actually more on that question on the next case study, which is actually a little bit the other way around. So EHR data migration. So one of the most common thing that we're actually doing in that step is migrating data in between EHRs. So for that one, that was actually a mental health billing service, and the challenge was to get all of the patient, all of the provider appointment information all together into their client, into the billing service billing.
So it's basically like EHR to billing
software. Yeah, multiple different EHRs into one single billing software. So they, as a billing service, could bill everything all together
Okay.
in one, in one operation. We actually integrated 10 EHR platforms. Most of them are actually super common ones, like Epic or ECW.
Epic just got easier to automate because their newest version is not a Citrix version.
Oh yeah, anymore.
It's a web-based browser. So if you have the newest version of Epic, it's so much easier to automate.
And the question, does it connect with via API? Yes, some of them do connect with API, but I think the biggest struggle here was actually to connect with those that don't support any API connection.
Yeah, obviously, if there's an API, that's what we were going to use first to automate, and then if there's not, we will automate with various other methods that we can do. We can reverse engineer APIs. We can automate the user interface. So we have a whole bag of weapons we can use against these malicious slow processes and softwares.
Thanks, Karl. Just probably already read that, but we onboarded 25 practices with over 150 clinicians, which makes of around thousands of appointments processed monthly this way. Fully automatic, of course. And the last one, you may think that those two are complicated and like, oh, they don't apply to you. So I picked one super simple one. So we worked with a client from Arkansas, basically a chain of general practitioners. And they had a totally different approach to automation, totally different idea. So they built with us like 20, 25, or maybe even 30 small automations. I'm going to show you some of them today. But this one was super easy. Take all appointments scheduled for the next day, get the patient data from their EHR, and send a reminder like, hey, you have an appointment tomorrow, don't miss it.
I feel like most EHRs, or at least the ones that are written after 2015, should have this built in somehow.
And you're right, Karl. You're right, Karl. Most of modern EHRs, EMRs actually has this feature out of the box. But the thing is that if you're using some old software that don't really have this kind of feature, some of them don't have like a billing capabilities, and you need to like connect EHR with the billing software. That's happening all the time, but
it makes sense. And then it's a question of, hey, do we migrate everything we've been doing for 10 years for this additional one feature we need, or are we going to automate it? I think this is the okay.
So like instead of like doing like a huge project of migrating from one EHR to another, so from old one to a new one, you can actually add this small feature that you really need into your existing EHR through automation.